The most common ophthalmic procedures include upper eyelid blepharoplasty, lower eyelid blepharoplasty, and upper eyelid ptosis repair. Patients who have extra skin on their upper eyelids are patients who would benefit from a blepharoplasty, which means that we remove the extra skin and/or muscle of their upper eyelids. Patients who have droopy upper eyelids usually need a little bit of a tightening of the muscle that elevates the eyelid to help put the eyelid in the appropriate position. And patients who have extra skin and fat along their lower eyelids need what's called a lower eyelid blepharoplasty. And in that surgery, we actually remove some of the fat and some of the extra skin along the lower eyelid to give a natural, more youthful appearance. At times, a patient will come to me with concerns from a cosmetic perspective, but when I evaluate them further, I'm able to identify that there's actually a functional limitation to their eyelids, whether it be droopy eyelids or extra upper eyelid skin. And I can further recommend surgery that will help them improve their daily activities. While there's no ideal age for cosmetic surgery, I find that most of my patients present to me with signs of aging at around 50 or 60 years of age. I have a lot of patients that present to me with tearing in their eyes, and oftentimes that's a result of having a blocked tear duct. We have a very complicated drainage system between the eye and the nose from which the tears of the eye exit into the nose. And when that blockage occurs, the patients end up having spillover of tears onto their face. And one of the most important things to do when having a patient who presents to you with a diagnosis of a blocked tear duct is to confirm the fact that they actually do have a blocked tear duct. And so a very thorough clinical evaluation is critical. And depending on the finding after the evaluation will dictate what type of surgical approaches to proceed with. If the tear duct is partially blocked, I recommend placing stents along the nasolacrimal system, just like a cardiologist would place a stent in a blocked artery along the heart. If a patient presents to me with a fully blocked tear duct, I recommend a procedure called dacriocystorhinostomy. And that's a long word for basically creating a new bypass system in which I make a hole along the bone in the side of the nose and place stents through the newly created bypass tract. Patients usually present to me a week later much happier as they no longer need tissues to dab the tears that are coming out of their eyes, and they don't have that reflex of the tears when they're taking pictures.